Okay, you can see that participants are starting to come in, so we'll just give it 30 seconds. Yeah, I think you were sharing your screen then, Justin.
Yeah. Right. Oh, I thought I was sharing this on my Facebook, but I wasn't, was I?
No.
Right.
You got a peek at your Facebook page.
Right. Is that the bit I need to? I'm just trying to work out how to share it on my my Facebook feed.
I'm about to post a link in the chat on the bottom line. Sorry, there'll be a link posted in the chat for everyone to share. Bear with me.
Well, you got to see my Facebook page, which is obviously publicly available anyway, so it's not.
Yeah, we're just going to share the Facebook Live link in the chat for everyone, and it will be available on there for some time afterwards in case you want to catch up. There we go.
Here we go.
Okay, I think we can get started. I think most of the participants are in now. So good evening, everyone, and thank you for joining us today, and welcome to the Young Fabian Health Network in conversation event with Justin Madders. This event is the 110th event, part of a series of coronavirus conversation events hosted by Young Fabians that have been running with members of Labour's Shadow Cabinet. My name's Emma Stevenson. I'm the Parliamentary Liaison Officer for the Young Fabian Health Network. And my day job, I work in public affairs for Macmillan Cancer Support. And I'm delighted to be hosting this event this evening with my Health Network colleague, Nikki. Nikki,
hi everyone. So my name's Nikki. I'm the Vice Chair of the Young Fabians Health Network. I'm also a pharmacist by trade, currently working in the NHS Hospitals Trust in Oxford. So we've obviously been heavily involved with the response to the pandemic and the restarting of services and procedures which we had to cancel and postpone because of the pandemic. So been involved in getting all of that restarted, and obviously been, as a Labour Party member, being interested in what they've had to say about future party policy with regards to the pandemic and also just health in general. So it should be an interesting conversation.
Thanks, Nikki. So just a little bit of housekeeping before we begin. If you have a question that you'd like to ask Justin, we have a 30-minute Q&A at the end, so please do post any questions in the Q&A box just at the bottom of your screen, and we might invite some of you to ask the questions to Justin yourself by unmuting you. We will remind you throughout to put in any questions that you might have, so we can have a lively discussion. This will also be on Facebook Live, and will be available on there for some time after as well. But without further ado, let's formally introduce our guest, Justin Madders. Justin was first elected Labour MP for Ellesmere Port and Neston in 2015. He grew up in the constituency and became the first person in his family to go to university, where he gained a law degree. He qualified as a solicitor in 1998 and at the same time became a Labour councillor. He began his career in employment law, defending the rights of working people to be treated fairly and with dignity at work. Following his election to Parliament, in September 2015, he was made a Shadow Health Minister and served on the front bench. And from 2018, he was jointly appointed the role of Shadow Minister for Business, Energy and Industrial Strategy as maternity cover for the then Shadow Minister, Laura Pidcock. He remained in both roles until March 2019, when he resigned from the front bench. When he resigned from the front bench after voting against the party line on a second referendum, Justin had supported the Remain campaign during the referendum, but had accepted that the country voted to leave in 2016. He was reappointed in April 2020 of this year by Sir Keir Starmer into the position for Shadow Minister for Secondary Care, Workforce and Patient Health. Outside of his ministerial roles, Justin was one of the founding members of the all-party parliamentary group on the state pension age, whose purpose was to help women against state pension inequality campaign. And he's currently serving as the chair of the APPG on social mobility. He was awarded the overall People's Choice MP of the Year award for 2019 by the Patchwork Foundation, which was voted on by members of the public, which is testament to how the work he's been doing has been resonating strongly across the community in his constituency and beyond. And during the COVID-19 crisis, he's been holding the government to account for the failure of the rollout of their test and trace system, the devastating shortages of PPE, and in championing the work and contribution of NHS and social care workers during the crisis in the face of unprecedented pressures, the immigration surcharge, and now ahead of a possible second wave. So it's my pleasure to introduce to you Justin Madders. Thank you for joining us, Justin.
What a wonderful introduction.
No, we're delighted to have you.
Yeah.
So we're going to get started, and I'm sure everyone's thought of this question sort of themselves, but how has it been to step into your role as a shadow minister with such a broad and urgent brief during a pandemic?
Well, as you can imagine, it's been hectic, to say the least. I think every MP, when we first went into lockdown, saw an unprecedented surge in casework. Obviously, people just didn't know what was happening. People were worried about their businesses, whether they should do certain things, what was possible and what wasn't. And of course, there was a massive social knock-on effect from people having to sort of effectively, self-isolate for, well, it's 3 or 4 months now, isn't it, for some people? So before we even got on to doing the shadow ministerial role, we, literally such an incredible amount of work that we were just dealing with constituents' queries. I actually ended up setting up a sort of food bank in the office to deliver emergency packages to people who couldn't get out because they were having to self-isolate on the government's advice, because the government packages didn't always arrive. People weren't on the list, and actually it took a long time really for those systems to get running. So we basically set up something from scratch, which took a lot of time up, but thankfully that's becoming less of an issue now. But then obviously on top of all that, I actually got involved in the shadow health brief again. Pretty much the same role as I was doing before, but obviously in a pandemic, business as usual isn't where we are. So I did do a lot on workforce, do a lot on performance stats, but obviously performance stats were just not an issue at this time. And so we were all really seeing an awful lot of new issues that we hadn't dealt with before. Obviously, the availability of PPE, just actually understanding what was PPE was quite a challenge. The government advice changed, I don't know, something like 30 times in a couple of months about what was actually acceptable PPE, and there was always a suspicion that it was changing to suit the availability of stock. We learned a lot about how ventilators work, oxygen supply, all these kind of issues that you wouldn't normally acquaint yourself with. And of course, you've got to learn how pandemic worked with a new world. We learnt about testing and tracing, which is obviously something that has been a tool that local public health groups have had for many years, but this was the first time that we were talking about doing something on a a national scale. We're talking about developing an app from scratch, massive outsourcing to Serco to deal with that. Obviously, that's questionable as to whether that's proved to be good value for money. We then had obviously the issues over PPE, the way social care has been neglected. And then it was just really quite a challenge keeping track of what was happening from day to day. New government announcements were being made on a daily basis. Obviously, there was a government press conference every day, which we're watching very, very closely, because they developed over time, and it was always interesting to see the questions that the media were going on, because quite often they would be things that we'd been picking up in the previous few days, and you always knew from the answers that weren't given where there were things that the government weren't really too comfortable with their position, and then the result of that was that we had lots of extra media to do, lots of sort of comments and analysis on the day's press conferences, and there's a really difficult balance to strike, because clearly we've got a job to do as the official opposition, but we don't want to be seen to be being too partisan and point scoring during a pandemic. And so clearly we wanted to point out where things could have been done better, but also we were trying to be supportive where the government were getting things right, and that's one of the things that's been a challenge, and especially when there are so many things I think the government could have done differently. So yeah, that gives you a flavour of how hectic it's been, and every day there is something new. Even now, we're beginning to understand how quarantine from international visitors is going to work, because that was something that didn't really happen at all during the first phase of this, and certainly there's some evidence to suggest that a lot of our early infections were coming from people who've been on holiday in Europe and were bringing it back with them. So that again is something where I think the government have got to do a lot more fine tuning in how they actually deal with that. And already today I've had several emails of constituents who are in Spain or just coming back from Spain saying, what am I supposed to live on when I get back? And it's a massive challenge, because as we're probably going to go on talk about, the chances of a second wave are pretty high, really. I think most people expect there will be some form of second wave at some point.
Yeah, sort of speaking about the role of the opposition, just wondered, so Keir Starmer said last week that the Labour Party is under new management. Just wondered what his leadership meant for health and care policy in the party, and how does this compare to your sort of previous experiences in the role?
Well, I don't like to get into comparing different leaders. I think that's a rabbit hole that the Labour Party shouldn't get into, because it just becomes about that rather than what we can offer the public positively. And I think actually, if you compare where we are at the moment with what's gone on before in politics at any point, never mind the last few years, we're in completely uncharted territory. So Parliament hasn't been operating in the normal way. You've seen Prime Minister's questions has been quite different. I think Keir's done a really good job there, but it's very difficult to know whether he would be as effective if there were, full crowd of braying Tories behind his back, which obviously Boris Johnson has been keen to see, but equally, if he was able to, use some of his questions to silence, and that would be even more effective. And obviously, Parliament isn't really going to be having those seats for some time now, so the direct comparisons are difficult to make. And obviously, Parliament as a whole isn't operating fully up to speed anyway. And of course, in a pandemic, things are different to politics as normal. The opposition has a slightly different role to play, and I think that it's probably not the right time for him to be setting out in great detail his vision for the future, because obviously things are so uncertain at the moment that it would be premature to be sort of sketching those things out. But I think if you look at what the polls have said so far, he's creating a very good impression with the public, because his personal ratings are some of the highest we've seen in any leader of the opposition for a long time. So he's definitely made a good start in pretty difficult circumstances for any leader of the opposition to be making a mark when we're in this crisis.
Yeah, apologies, we had to play devil's advocate there. But you spoke about concern about a second spike, so I'm going to pass over to Nikki, who's got some questions about that.
Yes, so my opening question is that there has been concern about a second spike. Some people are touting that it could potentially happen around winter time, which would obviously be a concern because we'd have the winter pressures alongside potential influenza. There are concerns even at the moment of there being a second spike with cases increasing across Europe. So what I wanted to ask is, what is the party saying about what needs to be done so that if and potentially when this does happen, the NHS and the social care sector are ready and prepared for when or if the second spike does occur?
That's a really important question, because I think that, you know, if you give the government a little bit of latitude for not getting everything right the first time, there can be no excuses for getting anything wrong on a second wave. Can I just ask, Emma, were you drinking wine there, by the way?
No, it's Schlepp.
Oh, right. I didn't think you. Oh, gosh, we're not that boring, are we, that you're on the wine already? But on the second wave, actually, it got picked up at Prime Minister's questions a couple of weeks ago when this Academy of Medical Sciences report was mentioned. It was the one where Keir Starmer referred to it, and asked Boris Johnson whether he'd read it, and he said he was aware of it, which we all know means he hasn't read it, because that was basically a government commission report on the things that need to be put in place to avoid a second spike, or at least mitigate against the worst effects of it. So there's some really important stuff in there. I think one of the key things which was in the news the other day is a much more comprehensive flu vaccination program, which the government announced, I think, last Friday. They've widened the number of people who will be eligible for the vaccine. It's basically anyone over 50, so I don't quite qualify yet. But it's actually, you know, we're talking 25-30 million people who will potentially be eligible, which is an incredible number of people to get vaccinated in a short space of time. And the take rate of these programs isn't great at the best of times. And I think that, you know, there is a worry because the vaccine probably isn't going to be on stream till September, maybe October, which means that we haven't really got very long to get a lot of people covered in a very short space of time. So there's going to have to be a real effort to get that organised. There's also some quite important stuff about how services in the NHS are going to have to be split into COVID and non-COVID moving forward, because obviously one of the problems and one of the concerns that we've picked up is that people have been going into hospital with other conditions and actually contracting coronavirus whilst they're in hospital settings. We've actually asked the Health Safety Investigation Branch to look at that, because we're very concerned about the implications of patient safety and that. So what I think people want to see in future is that there's a very clear and distinct way for people with suspected COVID to be treated, so that there is no risk of transmission of the virus. And then really one of the really big parts of it, which we've been persistent on for some time now, is a really world-beating almost test and trace strategy, which of course we were supposed to have at the start of June, but it's still got some way to go. So we think that really there ought to be a proper app working by the time we get to winter. Certainly some other countries seem to have managed it, and clearly there's a lot of nonsense about not using the Apple and Google software, which they've now backtrack on. And I don't quite understand why it was so necessary for them to insist on using their own software and technology when it was obvious that there was something already out there that they could have adapted. But it's cost us a lot of time, frankly. And when you look at some of the figures for contact rates for people who have been in contact with someone who's tested positive, they're quite low. They don't normally get over about 50%. So there's about half of all the people who may have been in close contact with someone with coronavirus who we're not getting in touch with and asking to self-isolate. So it's hoped that an app will really make a difference in that arena, because clearly one of the big issues with this virus is that once it's out in the community, it will transmit. So making sure that anyone who does have symptoms is identified early and has to isolate as soon as possible is going to be key to tackling this in the winter, particularly when lots of people are going to have similar symptoms but won't actually have coronavirus. They will have a flu or a common cold, and making sure that the testing system is top rate, which means that tests are getting back within 24 hours for everyone, and that's not happening at the moment, is absolutely key. But I mean, I think the government have got a clear idea of what needs to be done. It's now up to them to make sure that they deliver on it. Obviously, track record so far has been mixed at best, but there are some very clear asks that need to be done, and that report, I think, is really the key to all that.
Yeah, definitely some important points made there. Do keep posting any questions. If you do have anything that you wanted to put to Justin, post them in the Q&A. So the other thing that I wanted to ask about as well is that I think it's been pretty much widely acknowledged that the UK didn't equip care homes sufficiently for the outbreak, whether it was that people working in care homes didn't have sufficient protective equipment, or that people were going into hospital and then being discharged back into care homes who were positive for COVID, but because they weren't being tested for whatever reason, they were then bringing the virus back into their care homes, which contributed to the number of outbreaks that were taking place. So what more do you think we need to do to make sure that social care is regarded with the same amount of importance as the NHS and the healthcare system? Because that has been one of the things that has been brought up, is that people working in the social care sector feel like they aren't seen, they're not taken as seriously, or they're not seen as important as the NHS is.
No, that's a really fair point. I mean, for someone like myself who's been involved in health and social care for some time, I see it as, it's all interconnected. You can't deal with one and think the other one is going to be okay. And coronavirus has really, I think, brought that home to all politicians. I think most of us who deal with health issues on a regular basis understood that the interplay was there, but I think now even the Prime Minister realises that actually the idea that social care is a completely separate entity that doesn't have any impact on the NHS is clearly a nonsense, and actually that, whether it's coronavirus or whether it's winter pressures or any other challenges facing the NHS, that if you don't deal with social care at the same time, you're not actually going to deal with the issues in the NHS. So I do hope that there is a much more joined up approach. I mean, that clearly what happened this year was that there was a real attempt to sort of get as many beds cleared as possible in the anticipation that they were going to be needed for coronavirus, and that meant a lot of people were discharged into social care. Probably, I mean, the government say it was all clinically appropriate, which I'm sure it was. But what is what is without doubt is that people weren't being tested when they were being discharged. And certainly when I was out here talking to people in the constituency early on, we were contacting care homes on a regular basis, and they were all struggling with PPE. I mean, everyone was struggling with PPE at the time, but we, the care homes and social care sector knew that they were at the back of the queue, and the NHS was going to be prioritised, and that can't happen again. They've got to be treated as equal partners in this, and it does mean that there's got to be a much more rigorous testing regime in the social care sector for not only for residents but for staff as well. Hopefully, we've got a handle on PPE now, and the idea that people were put in that position were initially exposed to the virus in hospital because they didn't really understand how easily it transmitted, and then sent back into residential settings where they were going to transmit the virus even more. It is a horrific thought that we got into that position, and there really is no excuse for that to have happened. And when we do get this inquiry, I do hope that there will be a regular focus on that, because I think that there's a lot of lessons that need to be learned there.
Yes, definitely. I do think that hopefully once it does come underway, hopefully there will be a lot of questions that will be answered that we have been waiting for during this time. I also wanted to touch on the topic which was so important last year and has been overtaken, which is the B word, Brexit. So it has reared its ugly head once again, and it is being brought up in the political domain, in the sense that the government seems to be wanting to go on as you were with our plans to have the transition period ending with its original end date despite the pandemic. So I guess in a way this is two questions in one, in that what do you think the pandemic is going, what impact do you think the pandemic is going to have on the negotiations, and what changes would you make into the way that the government are approaching the issue? And also within that would you consider asking for an extension to the end date, or do you think that there's a risk that could have a backfire effect on the party?
Well, I think it's pretty clear the party is not pushing for an extension. I know that'll disappoint a lot of people, but the reality is that time has already passed, and we are heading for an exit on the 31st of December. Now, it remains to be seen whether that's a really clever negotiation strategy from the government to force the EU to come up with a deal, because it's in their interest to get a deal as well, or whether it is the most reckless thing at this time that any government could possibly do. And obviously I'm very worried about the possibility of a no deal Brexit. As you said in your introduction, I resigned from the front bench because I couldn't support a second referendum. It's not because I don't believe in the EU. I actually, of course, campaigned to remain, but I felt that once we had voted to leave, we should honour that referendum result. And I would say that was the majority view in the country after the general election last year as well. That doesn't mean that I am completely wedded to doing something which is going to do irreparable damage to the country by leaving without a deal, particularly manufacturing. I think that it's really important that we do get something in place. So I'm extremely anxious that we don't get to the 31st of December, possibly in the middle of a second wave, with no deal in place, because I think that would be the perfect storm, and it would be a real tragedy for the country. And I hope that actually both sides have got enough common sense to realise that actually there may have to be compromise on both sides. Maybe what we end up with is not a full deal, but enough to see see us formally leave for good, not in a transition period, but not leave completely exposed to WTO terms, which is the worst of all. So, I'm actually worried. I've got a lot on the line if this isn't done right, but I'm also realistic enough to know that because of the majority that the government have got, they've set a very clear course that they are not going to change that now. It's not like last year where actually there were balance in Parliament. There was an opportunity for us to influence the trade deal. Now we're not going to get that chance. So you'd hope that some credence would be given to the overall picture if we're getting too close to the deadline. But we'll have to see. But it is a worry.
Yeah, definitely. I think it is a bit of a waiting game, so we'll have to see where we get to, and obviously where we are in terms of the impact that the virus is having on Europe and on the world as a whole. Okay, well, thank you very much, Justin. I'm going to hand back over to Emma now to continue with the questioning. Back to you, Emma.
Thanks, Nikki. And yeah, once again, if you have any questions, please put them in the Q&A box. We just have a couple more questions. We're going to change tack slightly. So it's really clear that you have a deep interest in fighting for what you believe to be right and in championing social mobility. And I just wondered if you could perhaps tell the story of your political life to our viewers, from your journey from young Fabian to employment lawyer and MP to shadow minister.
Yeah, well, so I grew up in the 1980s, so I'd never known anything other than a Conservative government, and what I saw was 3 million plus unemployed. I saw lots of devastation, frankly, from a government that didn't seem to care. So I decided when I was 16, 17 that I didn't like the way that the country was being run, and I thought we could do better. And I decided to join the Labour Party. Margaret Thatcher actually resigned on my 18th birthday, which was a very nice present. Although even then I was a little sad because I thought, well, that probably means the Tories have got a better chance of winning the next election, which of course turned out to be right. But I think at that age, I decided that I wanted to get involved in issues to do with fairness and equality and making sure everyone has the best chance of life. And so I thought, being a lawyer is a good way to do that. Unlike that, they're very much part of a business setup. But I qualified as a lawyer. I ended up doing employment law, which I'm very interested in because there is so much about the workplace which I think is fundamentally unfair and imbalanced against people who are at work, and I've used some before with the gig economy and all those other ways of exploiting people, but I actually just going to work and having what you think is a secure job can be undermined overnight. You hear obviously on the news, ex-global companies taking 30,000 people out of the workforce. Those people who live in our constituencies who will have absolutely no say on how their future is determined will be done by someone possibly on the other side of the world. It says, we've got to get rid of X number of people, and quite often it's actually just about making more money. It's not actually about starting a company. Clearly, the coronavirus is a lot more insecurity at work. So that's kind of what sort of led me on that side. And then I became a councillor on Westborough Council, which is way more. We went to unitary about 10 years ago, and I was chair of the housing committee in Borough Council, lead the council for a couple of years, and then I went on to the Unity Authority, and I got selected to stand for, and for me, it's sort of what I've always wanted to do, and you know, the ability to stand up and talk about things you feel passionately about, that people in your area feel things need something. It's a great privilege. I absolutely love doing that. We've had to choose which years have been MP in the last 4, because it's been pretty unpredictable, to say the least. And it's been, you know, we have re-elections. I should be speaking to you as someone who's just been re-elected for the first time. Every few months doing something new and quite difficult to deal with, and it's not been a sort of quite 5 years, that's for sure. And just when we got to the start of this year, well, this is the third time we're going to have a 4 or 5 year parliament. There going to be any elections, we can begin to sort of work in a more strategic way than worrying about whether there's going to be an election called the next minute or not. And then coronavirus happens, and we're sort of so great job, and absolutely doing it, and I hope I keep it for a while longer. We absolutely have to do better in the next election. To get to the MPs is just, it's just not good enough to all the people trying to fight for to get a better world, to get ourselves to the show we can win next. And I think so far the signs have been encouraging.
Yeah, we agree completely, and I think that young people will be an essential part of us seeing a Labour government in power in 2024. So I just wondered if you had a message to young Fabians or young people who might be watching that maybe are politically active or maybe want to run for a political position. What's the best piece of advice you've ever been given that you'd like to share with them today?
Well, I would say you have to be patient. You have to persevere as well. Getting into Parliament was something I wanted to do for 20 plus years, and it's very, very rare that you will end up becoming an MP, before the age of 30. I actually think that for me, probably for a lot of people, it's better to go and do other things, learn about things in life before you become an MP. It isn't like anywhere else. It's not like a normal workplace. And actually, you will benefit from having experiences there before you enter Parliament. Certainly, I would have loved to have done this a lot earlier, but actually, probably it makes me a better MP now that having been through any council meetings talking about how we're going to save a couple of grand, increase the increase and that. Those decisions, best interest groups, being in work, seeing how actually people get treated in the workplace, not only something about understanding how the law doesn't work. All those things are very, very useful coming into Parliament, because you have a little bit of a broader experience in life, and actually when you're dealing with constituency where you get absolutely everything figured on, it's really quite helpful to be a councillor and a lawyer, because half the people have got a complaint against them I'm a lawyer, so between those two things we feel really passionately about, get involved in that, get involved in your local party. I'm a big believer that our comeback is going to be based on parliamentary candidates who are already rooted in our communities, who are active and see as the voice for their particular town or part of our city. It's the way that we will earn people's trust and respect and actually earn their vote, because our track record on the ground of delivering for people and standing up for them. And I think that, you know, there's going to be so much fake news in the next election that actually having a local voice that can possibly say, well, actually, this person's been around the past five years, so doing X, Y, and Z is going to be really, really important moving forward. And I think it's actually the way that we will not only win seats, but we will retain them.
Thanks for that, Justin. I think we're going to move on to the Q&A now, because Nikki and I have spoken for long enough. But I'm sure that will, lots of people will find that really inspiring. I certainly do. So we've got our first question from Amy Hall. I'm going to see if I can invite her to ask her question. We'll see if she's still on the call. Doesn't seem to be. Oh, hi Amy.
Hello, sorry, the button kept flashing at me and I kept missing it.
So, would you like to ask your question? It's a really important one.
Thank you, that would be great. The overall theme is asking, what would you do to make the healthcare system work better for people with long-term illnesses? I'm asking because disabled people and others with long-term illnesses currently have so many difficulties in the current healthcare system. Could be things like specialists and GPs not being able to share like key health information with each other in particular, when patients have like multi-specialty care or multi-location or just long-term. And it seems like a lot of the NHS is set up for either acute care or urgent care, whereas I think it's 20 to 25% of the UK have a long-term condition, and 50 to 70% of all GP appointments or outpatient appointments and inpatient bed days are for people with long-term conditions. And as one of those people, it sometimes feels like we get forgotten about, and it'd be great to hear if Labour has any plans to address these needs.
Do you want me to respond? Okay, well, Amy, that's a really, really good question. We're not, you know, at the stage yet of reading off specific policies, and I think what we want to be doing over the next few years is talking to members, actually getting their experience, and yours is a really, really important one. My wife actually has a long-term condition, which you know, I see it from that perspective, that actually first of all, actually GP knowledge of some conditions is not great in the first place. So just getting a referral to a specialist is sometimes a challenge. And actually, I think one of the things that I've heard from people working in the NHS in terms of how COVID has changed things, actually, they think they probably can make the journey a little bit smoother in terms of having an assessment appointment, then another referral, and sort of 3 letters being written before you actually get to see anyone. I think they realise actually you can do things in a much more streamlined way. And of course, one of the key things that people often talk about is having to say the same story on more than one occasion, and you know that and that can be in the same visit sometimes, which is really frustrating for people. So you know, I know there is still work going on to try and get much more electronic medical records on online for not just individual GPs, but also for trusts. NHS and IT are not great bedfellows at the best of times. But I think we also need to look more at having more care out in the community, actually, to suit people in their own settings. I think, again, that's something that's come through on COVID as well. People actually feel it might be better in the long run if that can be done as well. So I think that there's an awful lot we can do in terms of improving the patient experience, the patient journey, whatever jargon people want to use. And I think those people who've got recurring conditions who will have to have multiple appointments have definitely got a lot to say to me personally about what can be done better in future. So I think that's a really, really good question, and certainly something we'll be taking on board.
Thank you, that's amazing.
Right, okay, I think we've also got a question from George Johnston. So George, I'm going to unmute you now. Hold on a second. Right, it doesn't seem to be allowing me to allow you to talk, George, unfortunately. So I'm just going to read out the question for Justin to reply. So the question from George Justin was, what would you suggest to limit the dependency on the private sector and agencies created over the last 10 years, as the pandemic has highlighted this with outsourcing to companies like Serco?
Well, the first thing to do would be to abolish parts of the Health and Social Care Act, particularly Section 75, which requires the tendering process to be instigated. So I think obviously private sector involvement in the NHS takes lots of forms, but that is one obvious area where decisions are basically forced upon CCGs or trusts to actually outsource, because the legislation makes them tender the service. So that's I think, number one, without any doubt. And actually we need to then really probably do a proper root and branch review of where there is a lack of capacity in the NHS, and where things are having to be taken outside. And clearly the pandemic has been used effectively as a cover to massively increase the amount of outsourcing that's gone on. We know that obviously Serco is the main example, and actually if you look at the stats as to how many contact tracing efforts are made by Serco, the public health people are doing far more, and they're doing it better, and they're more efficient at it, and you would expect them to be more efficient at it as well. But it does beg the question as to why the decision was made really to recruit 25,000 people through Serco. You can look at the testing stations; they've all been outsourced. The labs, there's a big issue with the testing labs, whether that was the right approach as well, because they set up these sort of four, I think they're called lighthouses, where actually there was arguments that there was already capacity within the NHS which needed to be built up, rather than just say, right, we're going to give it all to these outside people. And then PPE is the other one where, as you may have seen, we've asked the National Audit Office to investigate the handing out of contracts to companies who, on the face of it, have very little track record in anything, let alone delivering PPE. So there's a big job to do to actually just try and unpick some of that before we look at what was going on before. But we know every year that the amount of private expenditure from NHS money has been creeping up and up, and yeah, clearly we want to see a reversal of that as much as possible.
Thanks for that answer, Justin. We've got a question from the chair of the Young Fabians Health Network, Milo. So I'm going to see if I can bring Milo in to ask his question. Hi, Milo.
Hi, Emma. Hi, Justin. Thank you for coming today. It's a great event. My question is, with hospitals dealing with a long backlog, does Labour have any plans to promote community healthcare, such as opticians or pharmacists, to avoid unessential hospital appointments? And I'm slightly biased in this because I work for the Association of Optometrists, and we're dealing with a lot of areas where they could be dealing with some of the backlog. So, for example, there's been a decrease in 93% of cataract operations. And we know for a fact that current rating is 20 people go blind every week. And lots of these appointments, checkups for glaucoma and what have you, could be done in a community settings. And, instead of having to go into hospitals, and then this would allow ophthalmologists to focus on the core part of their job rather than dealing with unessential, less high priority work. So we're wondering how we can do this more community care, because we often try and talk to MPs and other people, but we're not getting much of a response. It's a very busy time, but we are trying to promote this more community care to make sure we have a more holistic approach to, as well as promoting the high street as well.
Well, yeah, I mean, that last point, promoting the high street, of course, is another victim of COVID, which we haven't really talked about. Obviously, it's a bit off the point. Perhaps, Milo, we should have a separate discussion. I'll say offline, but it will probably be online, won't it? But we could have a separate discussion, because I'm quite interested to hear what you said there. I mean, there has been a push in recent years to try and use pharmacists, in particular, in a much broader sense, to try and take some of the pressure off GP surgeries and trusts. And actually, I think that if we've got those skills in the wider NHS family, we should be looking at how best to use them, particularly at the moment when actually we know that the backlog for so many procedures and operations is, well, I'm not even quite sure what it is at the moment, but some of the figures have been bandied about of a 10 million plus waiting list by the end of next year, which is quite, well, I mean, I say it's not unimaginable because we are talking about it, but given where we were a few years ago, it is a mind-boggling figure. So there is a huge challenge that the NHS faces over the next few years, which is trying to get the backlog, which is building up anyway. Actually, we absolutely must make that point that it was already getting to pretty record levels before the pandemic, and how we actually best try and tackle that is a huge challenge. And I think there's something the government haven't really begun to talk about yet. And I know trusts themselves are extremely concerned about it as well, because obviously the way their funding works, they get paid so much per procedure, and that could have a knock-on effect if that isn't dealt with in the next financial year. So let's have that conversation somewhere else. I'm sure that Emma or Nikki can pass on my contact details, because there's no doubt that is a big challenge moving ahead. And you may have picked up today that there's a suggestion that the government 4-hour A&E waiting target is going to change. I don't think that's been confirmed yet, but we know they've been looking at that for some time. But we also know that the sort of statutory 18-week wait maximum for an operation probably going to be jettisoned, because it's not been met for about 4 years now anyway, and clearly it's not going to get met anytime soon. So there are lots of important service standards that were actually introduced by the last Labour government that are at risk of being lost for good. And when you don't have those measures of performance, it's not as easy to hold the government to account for their failures, of which, of course, there are many.
Great, thank you very much. I will contact you for tomorrow morning if that's possible. Oh,
yep.
Great, thank you.
Okay, we don't seem to have any more questions in the Q&A, so we'll let a few more come through just in case. But I do actually have a question for you based on my line of work, which is at Macmillan Cancer Support. Obviously, our big campaign is the Forgotten C campaign. We're really concerned that cancer will be overshadowed by the other C, coronavirus, during the crisis. One of the big hard-fought wins that we had really been pushing for was personalised care within the cancer pathway, so access to holistic needs assessments, mental health support, complementary therapies, which Macmillan volunteers often facilitate. And what we're concerned about is that naturally during a crisis, things like that aren't seen as a priority, but that these really long, decade-long hard-fought wins will be lost, and sort of wondered if there are any other examples that you're particularly concerned about that might sort of, in the restoration of NHS services, regardless if we have a second wave or not, might sort of be forgotten in the process.
That's a really, really good point. Obviously, there's been some pretty scary figures that we've heard about, the number of additional deaths from cancer that may be because coronavirus has led to failure to detect disease early enough. So that's one side of it. But the other side, of course, is actually the many good things that need to be done in terms of the overall holistic approach to care when people have cancer, because it's something you have to cope with for an awful long time, and it pervades every aspect of your life. So the work that Macmillan does make a real difference, and there is always that we just muted me. get to sort of just pushing people through as quickly as possible, and I know a lot of people who had the treatment delayed because of COVID, how anxious they are about and can't let the fact that they're hopefully going to get treatment now and get back on that pathway detract from the other important stuff that needs to be done. So in terms of other areas where that might be a risk or a problem, I suspect most areas will have some impact in that sense. I think services has been run quite differently. Obviously, maternity services, you can't put off the work because the baby's coming whether you want it that particular moment or not. And they have to change a lot of things they do, and they probably have to and some of the wider sort of things that they would normally like to do as a result of COVID-19. So I think that all goes to vaccination experience, and we need to understand that actually treating the physical symptoms is only one part of it, and the other impacts may continue for some time. So I think that there's probably ways we can track that in terms of patient satisfaction, service, and so on. But I suppose that will just be a retrospective rather than a sort of look at things as they happen. So I think that's probably what I'd say is actually to people who are watching this, they're aware of things that are changing and not for the better. Touch line is to let us know, because we'll always be just here what's been going on.
Thanks for that answer, Justin. I think Nikki's got another question for you.
I do, yes. So I wanted to ask about what your opinion was and your response was to the recent announcements from the government about their public health initiatives, including the changing on advertising of unhealthy foods to us getting vouchers to repair any old bicycles we've got.
Well, I mean, it's been long overdue, hasn't it? That we know that there's a massive connection between, you know, your weight and your medical experiences, and we know the number of people who've been admitted to hospital for obesity-related conditions has gone up. I think just about every year in recent times. And if you look at projections moving forward for the NHS, they all come with the caveat that actually, if people don't get healthier and try and live healthy lifestyle, things are going to get even harder in terms of demand. So it's absolutely right that we begin to tackle this. And I think obviously the challenge and the concern is that they don't want to be called a nanny state people. And obviously Boris Johnson, having now gone through his experience and having admitted himself he might need to lose a bit of weight, probably is in the best position to understand and articulate to people why it's important that we all look after ourselves. But we know it's not easy, and we know that there's a lot of confusing information out there. It's actually probably easier to live on a smaller budget with options that might not be quite so healthy. You might look at what government are doing with 50% off eat out vouchers and say, well, that doesn't really stack with what we're trying to do on healthy eating, because obviously those vouchers can be applied anywhere. I think the point of view is it's got to be something that is a long-term commitment. It's not something that the government announced now, as they have done, and then in a couple of years' time, it's like, well, it hasn't really worked. We'll just sort of leave it where it is. It's got to be built on. I think what the government announced is okay. It doesn't go far enough, but it's got to be start of a very very different approach really from government to actually accept that it's part of their responsibility to ensure that they give people the right tools in the right information to make informed choices about their own lives, because we have to try and make more of a collective effort as a nation to live as healthy as possible. And time will tell whether what's been said this week is a small response to coronavirus, or whether it's actually part of a genuine change of course. Certainly, if we were in power, we'll be doing an awful lot more. Once you set this course, you have to keep it. I think that too many initiatives get picked up for and then get dropped, and actually we've talked about changing the habits of the nation. That's not going to happen overnight, but it needs that sustained focus. It needs buy-in from everyone. So we don't want to expose political football, and actually it will take some time to bear fruit. But I think if you look at anything to do with future of the NHS, future social care, actually this is something that we cannot afford not to do.
Great answer. We've got one question. We'll make this the last so that we don't take everyone's evening up completely. This is from George, who asked a question earlier, and he apologises for asking another one. But he says he works in an NHS team in London that integrates health and social care. With similar schemes now operating in places like Manchester, do you believe the expansion of integrated multidisciplinary community care is a policy that Labour could pursue?
Well, that's a very good question, because that is, should we say, that's a live debate at the moment, and I think that clearly there are some good examples out there of where better integration has been working. I mean, the bottom line at the moment is that a lot of the good practice that's going on out there is completely contrary to the Social Care Act. So it doesn't actually have an official legal basis, and we know that actually Health and Social Care Select Committee has been on this for some time, has made a number of recommendations. One of them was actually the government needs to recognise they need to change the legislative basis for a lot of these activities. And I think what we've had quite a few reports in the last couple of months on government perhaps accepting that the Lansley Act wasn't a great success, and it may now be that it's possible for them politically to decide that they want to disown it. And then there is lots of speculation about where they're going to go next. Now, greater integration locally is one route, and that's certainly been what we've been hearing from ministers for the last year or two, in that they will be letting local communities decide how best to organise their services. However, more recently, certainly the sort of reports you read in the press suggest that actually the government have realised that they actually have a great deal of control over the NHS anymore, thanks to the Lansley Act, and actually they want greater centralisation. So, I mean, in terms of where we are as a party, I think we're still having that discussion. Clearly, we need to see what the government come up with. There are certainly going to be parts of the dismantling of the Health and Social Care Act that we will absolutely be expecting. Obviously, in terms of Section 75 stuff particularly, but I think at the moment we would probably want to see exactly what proposals they've come up with. I think they've actually got quite a dilemma, because what they appear to want now is not what they have been saying for the last couple of years, and certainly I would imagine it's not what a lot of people who are actually working in the NHS want to see either, because having freed themselves from rival control, they don't really want to go back to it. Although, of course, the NHS is a political thing, and that's why we're on this call. Decisions that are made do affect people's lives. They are important, so there does have to be some personal direction. It's a really fascinating one, because we know that they're going to have to do something, and we know that it may come in the next 12 months. Quite what it looks like remains to be seen. And I think there's another report tonight saying that we're going to merge social care altogether into the NHS, so it was all done centrally that way, which would be against something quite different to what they've been talking about in the past. But it's a really good question, and it's something we want to watch the space on.
That's a great note to finish on. Thank you for that insightful answer, Justin, and for great questions as well. If anyone has any more questions, please do feel free to get in touch with the network. I've just put our email in the chat box. You can give us feedback on the event, and I'm sure, Justin, if we receive any questions, can we pass that on to your office for some answers? Yep. Okay. Well, we're not gonna take up any more of your precious recess time, but thank you so much for joining us, everyone, and especially thanks to Justin.
Thank you, Darwin.
We can be